What if you could lower your risk for heart disease right at your local pharmacy? That's the huge idea behind a new program from Queensland Health. So today, we're going to take a guided tour and walk through exactly how their cardiovascular disease risk reduction program works, step by step.
Everything starts with this one sentence. This is the whole reason the program even exists. The official protocol says that most cardiovascular disease is preventable. That is such a powerful statement because it means we actually have the power to change the outcome. Okay, so if it's preventable, then what's the plan, right? How does a program like this actually work to stop it in its tracks?
Well, the answer is all about making healthcare way more accessible. The program is built around your local community pharmacy, using that convenient spot to find and help people who are at a really high risk of cardiovascular disease.
So why is a program like this so important? Well, because it targets a really critical and frankly dangerous link in our health. You see, people with diabetes are at a significantly higher risk for cardiovascular disease. In fact, heart attacks and strokes are their leading causes of death. This program is designed to break that connection.
All right, so the first logical question anybody's going to ask is, who is this actually for? Let's take a look at the eligibility criteria, which is basically the front door to the entire program.
Okay, so the eligibility is pretty specific. On one hand, it's aimed at adults, anyone between 18 and 79, who are either at high risk already or have type 2 diabetes. But, and this is key, not if it's managed with insulin. Now, on the other hand, there are some really clear safety-based reasons you wouldn't be eligible, like if you're pregnant, have type 1 diabetes, or other complex conditions that really need a specialist's direct care.
Okay, so let's say you're eligible. What happens next? The very first thing is to create a complete picture of your health. Think of it like taking a really detailed snapshot to get your personal health baseline. And don't worry, this isn't some super complicated process. The program breaks it down into 3 really straightforward steps. First, you'll just have a chat about your personal and family medical history. Second, they'll take some key physical measurements. And third, you'll review important test results to get all the hard data. Simple as that. This chart from the official protocol, it shows you exactly how all those pieces fit together. It all starts with confirming you're eligible, right? Then it moves through gathering your history and taking those measurements. All that data from you and your tests, it all gets funneled down to one key outcome, a personalized management plan just for you.
So let's zoom in on what that snapshot actually includes. It's not just one thing. It's your medical and lifestyle story, it's key physical numbers like your blood pressure and BMI, and it's that crucial blood work, like the HbA1c test, which basically gives an average of your blood glucose levels over the last few months.
Now, with that health snapshot complete, we get to the real heart of the program, your action plan. And this isn't a pharmacist just handing you a list of rules. No way. It's a collaborative plan that you build together, and it focuses on 2 key approaches. The first pillar is the absolute foundation, lifestyle. The plan zeroes in on 5 key areas you can directly control: smoking, nutrition, weight, physical activity, and alcohol. These are incredibly powerful, non-medication tools for improving your health.
And if you need proof of just how powerful that lifestyle pillar is, get this. The source material highlights this incredible fact. For someone newly diagnosed with type 2 diabetes, just achieving and keeping a healthy weight can actually lead to remission. That is an absolute game changer.
The second pillar is medication support. So working right alongside those lifestyle changes, the pharmacist can prescribe specific medications to help manage your blood glucose. This chart gives you a quick idea of how different types of drugs work in different ways, from metformin, which is a really common first-line therapy, to others that help your body use insulin better or get rid of extra sugar.
But look, creating the plan is really just the beginning. This isn't a one-and-done kind of fix. It's a continuous partnership. The next part of the journey is all about staying the course through ongoing management and monitoring.
The framework for this is called the annual cycle of care. It's basically a structured way to make sure that every single year there's a really thorough review of your health. The entire point is to catch any potential problems early, before they can become serious.
One of the smartest parts of this whole program is that success isn't one size fits all. The clinical targets are personalized. For someone who's newly diagnosed, the goal for their HbA1c might be a really tight 6.5%. But for an older patient who might be at risk for low blood sugar, a safer, more appropriate target might be a little higher, closer to 8%. It's all about what's right for you.
So what does that annual cycle of care actually look like in practice?
Well, this checklist makes it really tangible. You can see the rhythm of the program. Blood pressure gets checked at every single review, HbA1c every 3 months, and things like eye and foot health are checked yearly or every other year. It's a proactive schedule to stay ahead of any issues.
And if there's one number that really defines the rhythm of this program, it's this one: 3 months. That's the typical time between your clinical reviews. It's that regular check-in point to monitor your progress, see if the plan's working, and make any little adjustments you need to stay on track.
So when you put it all together, this program does something pretty fascinating. It moves proactive healthcare out of the doctor's office and into the community pharmacy. It makes you wonder, and it raises a big question for all of us. Is this kind of accessible, community-based model the future of how we manage our health?